Secretary, Health and Family Welfare Department, Government of Odisha, Srimati Aswati S, who has played a key role in aligning Odisha's health programs with national initiatives such as Pradhan Mantri Jan Arogya Yojana and the Ayushman Bharat Digital Mission, with a strong emphasis on institutional strengthening, digital enablement and outcome-based governance to deliver the welcome address.
Good morning and a very warm welcome to this two-day consultation. As was mentioned, we will be deliberating on the implementation, the challenges and the way forward in the context of two of the most important schemes of the Government of India that touches millions, Ayushman Bharat Jan Arogya Yojana and the Ayushman Bharat Digital Mission. On this occasion, we are extremely proud and privileged to have with us Honorable Minister Sri Mukesh Mahaling. Government of Odisha, sir, has been instrumental in bringing about path-breaking changes in the health sector in Odisha, including a transition, a successful transition to the Ayushman Bharat framework. Under his leadership, the health sector has seen an unprecedented increase in our budget share, and also many reforms that strengthens not just the institutional framework, but the implementation network in the health sector in Odisha. So we are extremely happy to have you with us today, and we extend a very warm welcome to you. We are privileged to have with us Sri Sunil Barnawal, CEO, National Health Authority. Sir has been a source of support for the state team of Odisha. And sir, we very warmly welcome you. We also welcome Ms. Gayatri Rathod and Mr. Basant Kumar, Principal Secretaries of Health from both Rajasthan and Meghalaya. Both of them have done outstanding work in the field of health, and they always inspire us to do better in our state as well. Ma'am and sir, we thank you for accepting our invitation to be with us here today, and we warmly welcome you. We welcome the NHA team led by the CEO, sir, but also with Kiran Gopal Vaska, Ms. Jyoti Yadav, and Mr. Giyasuddin Ahmed, along with other officers of the National Health Authority. They have been extremely patient with Odisha during the transition years, transition months, very patiently taking care of our needs and supporting us. We're very happy to have you with us today and very warmly welcome you. We're happy to have with us distinguished guests from across the country, delegates from all states, development partners. We also welcome the Director, AIMS Bhubaneswar, academic leaders and support staff from our department and the ministry who are with us today, especially to the SAS team who has tirelessly worked day and night to make this event a reality. We welcome the friends from the media and also all the support staff that made this event a reality. And once again, we extend a very warm welcome to you. Odisha is a very good time to visit during Jan and February. I hope during the next 2 days, while we deliberate very seriously on the issues of Ayushman Bharat Jan Arogya Yojana and the digital mission, you all will take some time to enjoy the city as well. The city of temples, as we call it, offers a large variety of options. In fact, the team has very meticulously put together few activities for all of you, including a heritage walk in the morning and a cultural program, along with a small stall just outside from Utkalika that showcases Odisha's rich handicrafts and handloom with an attractive discount, of course. So I hope all of you will find some time to explore the rich cultural tradition that Odisha has to offer. Once again, we thank the National Health Authority for giving us this opportunity to host this event. We hope that the next 2 days of deliberations will enrich us with ideas to take the projects forward. Thank you all so much.
Thank you so much, ma'am, for that very warm welcome. Ladies and gentlemen, we have with us on stage Chief Executive Officer, National Health Authority, Dr. Sunil Kumar Banwal, under whose leadership the National Health Authority continues to strengthen the implementation of Pradhan Mantri Jan Arogya Yojana and ABDM with a focus on digital public infrastructure, system integrity, and improved service delivery outcomes across states and union territories. May I request him to set the context for this Chintan Shivir and present the opening remarks. Let's welcome him with a round of applause.
Namaskar, good morning, and let me also welcome on behalf of National Health Authority, Honorable Health and IT Minister, Government of Odisha, Sri Mukesh Mahalingji, the dignitaries present on the dais, Mr. P. Sampath Kumar, Principal Secretary, Government of Meghalaya, Gayatri Rathore, Principal Secretary, Government of Rajasthan, and Ashwati, the Secretary, Government of Odisha. All the dignitaries present here, the CEOs of state health authorities of different states and UTs, State Mission Director of Ayushman Bharat Digital Mission from across the country, different states and UT. Let me express my sincere gratitude to the government of Odisha for hosting this 2 days Chintan Shivir, which actually works with the review as well as knowledge exchange platform across the states, and a lot of ideas are deliberated upon for taking across the country. As has been told, these two flagship schemes of Government of India, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana and Ayushman Bharat Digital Mission are very important health care delivery schemes, and both are run through the state governments, and therefore it's extremely important that these two schemes are deliberated with all the states, and their best practices and knowledge are disseminated throughout the country. So this is 2 days Chintan Shivir gives us a lot of opportunity to discuss every details which is there with these two schemes. As we know, when Ayushman Bharat Pradhan Mantri Jan Arogya Yojana was launched in 2018. This was world's largest government-funded health assurance program. It is still the largest, and probably no other country are nearer to this. So that way, we should be proud of implementing a scheme which is world's unique largest scheme and covers bottom 40% of the population. In this, except for West Bengal, all the states are onboarded. Odisha and Delhi has onboarded recently, about 9 months back, but both the states are moving very fast. And that is why this Chintan Shivir holds a special importance, because hosting it in Odisha brings the state's commitment to go faster in implementation of these two schemes. As we all know, Pradhan Mantri Jan Arogya Yojana, it covers the underprivileged population against their catastrophic health care expenditure, and it also provides cashless delivery of health care for them. The most important advantage of this scheme is India has built such a robust IT system to run this scheme that any other schemes can be onboarded on this. And that is what is happening since 2018 when this scheme was started. Most of the state government has started their own scheme to cover part of the remaining population, but they all run on the same platform. So we have the advantage of collation of the data. We have the advantage of actually delivering the services as per the need of the state, at the same time keeping the standards same for the whole country. So this is the advantage we get when we run the different healthcare delivery programs on the same platform. So this brings us to a collective action to make this platform even more robust. So in these 2 days, we will deliberate what the states are facing, challenges in using the system. Can it be improved further? Can the local needs of the state be incorporated to suit their requirement? So these are the things which actually helps us to build the system more robust, and it will also help every state to understand that instead of building an isolated system for themselves, taking advantage of a national system to run their own schemes brings much more value. We'll see during the presentation how the trust and the confidence on the system gets built when we are able to catch fake or wrong claims made by some of hospitals. So this advantage states will not have if they run their isolated system. Further, developing many more solutions over the data which gets created through the system also doesn't represent the true picture if it is run only on the state-wide data. And therefore, this is extremely important. We have reached to a level in last 7 years to cover about 11 crore patients, and the country has got the patient data with their treatment history of 11 crore people. It's a very good data to run many of the artificial intelligence related solutions. This will create many solutions for predictive health. It will create solutions for clinical decision support systems, and that is how India will build a system which is not just a curative care, also building a system for preventive and promotive care. So with this, actually we are going to target a large population, and almost we have reached to about 44 crore Ayushman card. And in fact, most of the states have done very good job in empowering people by providing them Ayushman card, which is a big strength for the people against their catastrophic health expenditure. So this is actually creating a system by which people can get empowered and they can bear the against any kind of eventuality which we face in most of the state, especially in the remote rural areas. People, whenever anybody gets sick in the family, there is a quite likelihood they go back on their debt trap. And therefore, this is a insurance against their for their financial security. More than that, now, as I said, some of the states have started their own program. I must mention here today that about 13 states have become universal in health coverage. And this is a window which is giving to other states also to follow. And when we say universal health coverage, it is all on the same platform. And this makes them also to know that everyone who gets covered, how are they availing the services. So we have the data which can show that what kind of packages are mostly used, which are the diseases which are getting more. So this advantage we get because of the common national platform. The second most important scheme, which is Ayushman Bharat Digital Mission, we will be dealing during this 2 days Chintan Sivir in detail how this digital health can actually transform the whole healthcare delivery in India. I must tell you, though digitization in India in healthcare has started quite late compared to many of the developed countries, but it is one of the very few countries which has developed a digital public infrastructure in form of Ayushman Bharat Digital Mission, where we could create a IT infrastructure where health systems can talk to each other. So from a fragmented healthcare, we are moving towards integrated and intelligent healthcare. This benefit we have because we created the infrastructure first, and now we are onboarding the hospitals and other health facilities to run on this infrastructure. So we created the guardrails, and now we are actually promoting more and more trains to run over it. So now once we have created the guardrails, we are very sure the trains which run actually runs seamlessly and actually can create much more value. This in future we will be having a huge control over any solutions we develop because we can test against a large data. One big advantage with this system is we don't create a centralized repository of data. The data remains with the patient and the hospital, and therefore the privacy of the data is assured by design itself. So privacy, trust, security is by design in the system. The apprehensions which people or the hospitals may have is completely allayed by simple architecture which has been created by ABDM. As on date, about 85 crore citizens have got the Abha ID, which is the unique identifier for the patient. Similarly, more than 4 lakh health facilities, which includes hospitals, laboratories, pharmacies, have been registered and their credentials have been verified. That's very important because we know in a diverse country like India, unless we are very sure of the credentials, you cannot get the right service. By having registered on HFR, actually we are ensuring the service provider is verified, and it also helps them against the unverified providers. Similarly, health professionals like doctors, nurses, paramedics, allied healthcare professionals, all are verified. About more than 7 lakh professionals have already been registered. This also opens the window for all of us to think of a unified health interface. The way we have become an example in the world through the unified payment interface, UPI, and every citizen, even illiterate, are able to use UPI. In times to come, we will be able to use UHI to find out our doctor, find out our pharmacies, and get the services real time based on our requirement, based on our need of the time. So this is what makes the digital health extremely important. I'm very happy to say that some of the states have started digital health mission. States like Bihar, Jharkhand, and even recently I saw UP and few more states have created a digital health mission. It's very important because when we talk of AI solutions, AI doesn't run in vacuum. It has to run on data. The biggest challenge in this country is most of our healthcare data are highly unstructured. It is in a manual paper, which is very difficult to use, and therefore we need to run a digital mission to ensure that data which gets created in the hospitals, health centers, pharmacies are created in form of digital data, so that it can be used for developing many solutions for predictive health, for disease mapping, for disease surveillance. This only will help, and therefore the states who are looking at digital health or creating the digital health ecosystem need to look at that they need to create digital data in health sector. And that can happen only if we provide enough facilities at the health center for using digital devices and creating digital prescription, digital records. So this will be another very important thing, and sooner or later we will all be bogged down by the AI solutions. If we don't develop our own solutions, actually some of the foreign solutions will start flooding our healthcare. We have to guard against, because these solutions which are developed and tested against a foreign data, Western data, may not be applicable in Indian context. And therefore, two things are important. We create digital data in health sector, and second, we develop our own AI solutions which runs or tested against the Indian data sets. That will make our situation much better. It will make our basically health professionals and healthcare providers much more capable. With these, I think these 2 days are going to be extremely important, though it is being held in Odisha, which has started recently. I'm very sure the government of Odisha has taken both the schemes extremely seriously, and we will fill the gap of being a late starter to become a progressive and a forward state in implementation of these two schemes. And with these words, once again, I thank everyone for participating in these 2 days Chintan Sivir, and I also again thank Government of Odisha to host this event at Bhubaneswar. There are many more presentation which will take place in 2 days. Lot of learnings will come, and we will also review, because this events are held every quarter. Last we did it in Bhopal, so there are a lot of learning which came. We will produce our action taken report. States will also respond to all this, and then today we will actually take further steps forward, create the roadmap, and maybe take some of the decisions which can be far-reaching in the outcomes, and will build a national digital health ecosystem for actually implementing all healthcare programs, both through the public hospitals as well as private hospitals. With these words, once again, I thank and wish all success for the 2 days Chintan Sivir. Thank you.
Thank you so much, Dr. Banwal, for wonderfully setting the context for this today Chintan Shivir and your insightful address. Ladies and gentlemen, it's an honor to have the esteemed presence of Dr. Mukesh Mahaling, Honorable Minister for Health and Family Welfare, Government of Odisha, as the chief guest for the inaugural session of the Chintan Shivir. The Honorable Minister has consistently emphasized the importance of strengthening public health system, expanding financial protection for citizens, and ensuring that flagship programs such as PMJY deliver meaningful benefits on the ground through effective governance and coordination. माननीय मंत्री जी के नेतृत्व में उड़ीसा ने स्वास्थ्य सेवा के क्षेत्र में उल्लेखनीय प्रगति की है। उनका ये स्पष्ट मानना है कि स्वास्थ्य सेवा केवल कागजों या नीतियों तक सीमित नहीं रहनी चाहिए, ये आसानी से आम आदमी तक पहुंचनी चाहिए, और यही आज ओडिशा के स्वास्थ्य व्यवस्था की पहचान है। मैं माननीय मंत्री जी से निवेदन करूंगी वे सभा को संबोधित करें। आई रिक्वेस्ट हिम टू एड्रेस दिस गैदरिंग। लेट्स वेलकम हिम विद अ राउंड ऑफ अप्लॉज।
पूरे भारतवर्ष से आए हुए डिफरेंट स्टेट से ऑल आर डिस्टिंग्विश्ड गेस्ट्स, चिंतन शिविर पे आज हम लोग आयुष्मान भारत जन आरोग्य योजना और आयुष्मान भारत डिजिटल मिशन, ये चिंतन शिविर पे हम लोग आज 2 दिन तक बहस करेंगे। डिस्टिंग्विश्ड गेस्ट ऑन द डायस, CEO नेशनल हेल्थ अथॉरिटी, Principal Secretary, Health and Family Welfare Department, Government of Odisha, Principal Secretary, Health and Family Welfare Department, Rajasthan and मेघालय, ओडिशा सरकार के तरफ से पावन जगन्नाथ के धरती को मैं सभी को स्वागत करता हूं। नमस्कार, जोहार। आज हेल्थ सेक्टर में एक बड़ा वैप्लविक परिवर्तन हुआ है। 2014 में जब भारतवर्ष के यशस्वी प्रधानमंत्री नरेंद्र मोदी जी ने देश के भार संभाला है, उनके मन में एक चिंतन आया कि भारतवर्ष में एक नेशनल हेल्थ पॉलिसी क्यों नहीं लिया जाए। और आयुष्मान भारत जन आरोग्य योजना is the outcome of National Health Policy 2017। 2017 से पहले भारतवर्ष में एक ही सिस्टम चलता था कि पहले बीमार होना है, देन वी विजिट टू हॉस्पिटल। 2017 का जो नेशनल हेल्थ पॉलिसी है, उसमें सबसे बड़ा बात यह आया कि हम लोग कैसे आउट ऑफ पॉकेट एक्सपेंडिचर और प्रिवेंटिव एंड क्यूरेटिव हेल्थ केयर सिस्टम को एम्फासिस दिया जाए। और सबसे बड़ा बात यह रहा कि हम जो फाइनेंशियल रिस्क प्रोटेक्शन टू द एवरी सिटीजन ऑफ इंडिया, सो दैट कोई बीमार पड़े और अपना पॉकेट से खर्च करे तो भारतवर्ष जो हम लोग विकसित भारत के बात बोल रहे हैं वो आगे नहीं जा पाएगा। इसीलिए नेशनल हेल्थ पॉलिसी में हेल्थ एक्सपेंडिचर को 2.6% ऑफ जीडीपी का कैसे खर्च हो, इसी हेल्थ रिफॉर्म सिस्टम आयुष्मान भारत योजना को लागू किए हैं। और ये पूरे विश्व में सबसे बड़ा हेल्थ केयर के लिए यूनिवर्सल हेल्थ सिस्टम है। और आज हम लोग जैसे कि सीईओ हेल्थ अथॉरिटी बता रहे थे कि हमने अबाउट 42% ऑफ द टोटल पॉपुलेशन ऑफ इंडिया कवर्ड अंडर आयुष्मान भारत जन आरोग्य योजना। एंड आउट ऑफ पॉकेट एक्सपेंडिचर जो 2017 में 62% था, वो रिड्यूस होके अभी 2025 में 38% हो गया। तो हमारा जो विजन और मिशन है हमारे सरकार का, वो डेफिनेटली वी शुड थैंक्स टू द गवर्नमेंट ऑफ इंडिया। और आपको सबको पता है कि सस्टेनेबल डेवलपमेंट गोल्स 3 जो है कि गुड हेल्थ एंड वेलबींग ऑफ द सिटीजन ऑफ पीपुल ऑफ किसी भी कंट्री का होना चाहिए, ये इसमें कवर हो रहा है। उसी के साथ ही साथ आज उड़ीसा प्रदेश हमारे स्टेट जब नया सरकार बना अंडर द एबल लीडरशिप ऑफ हमारे लोकप्रिय मुख्यमंत्री मोहन चरण मांझी के नेतृत्व में हमने एक नारा उड़ीसा प्रदेश में लगाए हैं, एक टैगलाइन किए हैं कि सुस्थ ओडिशा विकसित ओडिशा बाय 2036। 2036 इसीलिए लिया गया कि अप्रैल 1936 में हम लोग जब उड़ीसा प्रदेश लैंग्वेज बेस्ड स्टेट बना था, 100 साल पूरा होगा 2036 को उड़ीसा प्रदेश, जब हम लोग ये सुस्थ ओडिशा विकसित ओडिशा के तरफ आगे बढ़ेंगे इन लाइन विथ विकसित भारत बाय 2047। और हमारा स्टेट द आयुष्मान भारत जन आरोग्य योजना 2018 में पूरे भारतवर्ष में लागू हुआ था, लेकिन उड़ीसा प्रदेश में डबल इंजन की सरकार आने के बाद हमने अप्रैल 11 2025 को 9 महीना हुआ है इसको लागू किए हैं। और जैसे कि सीईओ और हमारा प्रिंसिपल सेक्रेटरी बता रहे थे, ये 9 महीना के अंदर वी हैव अचीव्ड ए लॉट, एंड एज पर द लास्ट डाटा फ्रॉम द NHA portal, Odisha ranked first in the ABPM JY card distribution and 5th in the आयुष्मान भारत वयो वंदना योजना कार्ड जनरेशन। तो हम लोग प्रोग्रेस में हैं और डेफिनेटली आगे चल के हम लोग ये कार्यक्रम को हमारे प्रदेश के जो सिटीजन हैं उनके लिए एक अच्छा काम कर रहे हैं। हमारा स्टेट में जो आयुष्मान भारत योजना और एक प्रोजेक्ट है, हमारा स्टेट रन प्रोजेक्ट गोपबंधु आरोग्य योजना। हमारा पॉपुलेशन यहाँ है करीबन 4.5 करोड़। उसमें से हम लोग ये आयुष्मान भारत योजना और गोपबंधु आरोग्य योजना स्कीम में हमने 3.52 करोड़ पॉपुलेशन इंडिविजुअली हमने उसमें शामिल किए हैं। और हमारा और एक यूनिक है यहाँ कि हमारे वी हैव कवर्ड अंडर दिस स्कीम प्रोवाइडिंग कैशलेस ट्रीटमेंट अप टू 5 lakhs for family per annum with a additional 5 lakh for women member. These benefits are available in nearly 32,000 ambulant private and government hospital across the country. और हमारा आयुष्मान भारत वयो वंदना कार्ड के अंदर हम लोग 22.41 लाख सीनियर सिटीजन above 70 years and above have been entitled to separate cashless treatment up to 5 lakhs per family per annum, along with an additional 5 lakh for women member aged 70 and above. हमारा स्टेट में आयुष्मान भारत डिजिटल हेल्थ मिशन डेफिनेटली उसको आगे लेने के लिए हम लोग गेट फाउंडेशन को ऑनबोर्ड किए हैं टेक्निकल पार्टनर के लिए। और आगे मैं आज सुबह हमारे विथ ए कप ऑफ टी सीईओ नेशनल हेल्थ अथॉरिटी से बात कर रहा था। हम लोग भी और गाइडेंस लेंगे कि कैसे ABDM को उड़ीसा प्रदेश में आगे ले जाने के लिए उनका जो गाइडेंस रहेगा भारत सरकार को, इसी को भी हम लोग आगे लेने के लिए ट्राई करेंगे। मेरा 2-3 सुझाव है इस चिंतन शिविर में। जैसे कि एक संस्कृत में श्लोक है कि न आरोग्यण सुखम न वितेण कर्मणि सुखम। That means without health there is no happiness. Wealth alone cannot bring happiness. तो हमारे स्टेट में इसको लागू करने के लिए और पूरे भारतवर्ष के प्रधानमंत्री नरेंद्र मोदी जी जो अभी आप लोग देखे होंगे कि ट्रेडिशनल मेडिसिन के ऊपर एक चिंतन शिविर के साथ ऑल इंडिया इंटरनेशनल कॉन्फ्रेंस भी किए थे। उसमें नेशनल हेल्थ अथॉरिटी और आयुष मंत्रालय के तरफ से ये कार्यक्रम लिया गया था। और एक गुरु मंत्र वहां दिए हैं कि आयुष्मान के मतलब क्या होता है। ए पर आरोग्यम हेल्थ, वाई योगा, यू उपाचार, एस स्वास्थ्य संकल्प, एच हर दिन सुरक्षा, एम स्ट्रेंथ ऑफ माइंड, ए आयुष एंड आयुर्वेद, एन क्रिएशन एंड प्रोग्रेस। इसी के साथ मैं यहाँ और एक सजेशन चिंतन शिविर में देना चाहता हूँ कि आयुष्मान भारत जन आरोग्य योजना में हमने तो पूरे भारतवर्ष में मॉडर्न मेडिसिन और एलोपैथी को यहाँ कवर किए हैं। मेरा ये सुझाव रहेगा इन रिसेंट ईयर्स हम लोग आयुष मेडिसिन और होम्योपैथी, आयुर्वेदा और होम्योपैथी ट्रीटमेंट को भी इसका पैकेज कैसे बने, ये चिंतन शिविर में होना चाहिए। और इसका पैकेज भी हमने चालू करना चाहिए, जो कि हमारे भारतवर्ष के प्रधानमंत्री का, नरेंद्र मोदी जी का जो वही मिशन और विजन है कि आयुष मंत्रालय को भी जब हम लोग स्ट्रेंथन करेंगे, ये नीचे तक जाएगा और लोगों के पास एक कॉन्फिडेंस डेवलप होगा कि हम लोग ट्रेडिशनल मेडिसिन के साथ साथ हम लोग मॉडर्न मेडिसिन, एलोपैथिक मेडिसिन पर जाएं। और दूसरा ये चिंतन शिविर में डिस्कस होना चाहिए कि वन हेल्थ प्लेटफॉर्म, वन नेशन वन हेल्थ प्लेटफॉर्म के तहत ये एलोपैथी, आयुर्वेदी, होम्योपैथी एंड आयुष तीनों को जोड़ के कैसे पैकेज बना जाए, उसमें हम लोग ट्राई करना चाहिए। और इसी शब्दों के साथ, इसी वर्ड के साथ मैं सभी को फिर एक बार उड़ीसा प्रदेश में स्वागत करता हूं। और ये 2 दिन का चिंतन शिविर में आप डेफिनेटली प्रभु जगन्नाथ के दर्शन तो करेंगे, इसी के साथ साथ यहाँ का हैंड क्राफ्ट और वाइब्रेंट कल्चरल एक्टिविटी को भी एंजॉय कीजिए और कुछ एक्सपीरियंस के साथ जाइए। और जो भी इस 2 दिन का चिंतन शिविर में निकलेगा वो हमारे स्टेट अंडर द एबल लीडरशिप ऑफ हमारे चीफ मिनिस्टर मोहन चरण मांझी जी इसको आगामी हमारे फ्यूचर कोर्स ऑफ एक्शन में इसको इंक्लूड करेंगे। थैंक यू। जय जगन्नाथ, भारत माता की जय।
माननीय मंत्री जी के प्रेरणादायक अभिभाषण के लिए हम आभार प्रकट करते हैं। Thank you so much, Honorable Minister, sir, for your very inspiring words. Ladies and gentlemen, we now move to an important segment of the inaugural session, the launch of key initiatives in collaboration under Pradhan Mantri Jan Arogya Yojana and the Ayushman Bharat Digital Mission. May I first request Honorable Minister Dr. Mukesh Mahaling, along with all our esteemed dignitaries on dais, to release the Health Benefit Package Manual Part 2. So I'll request our Honorable Minister and esteemed dignitaries to do the honors and release the Health Benefit Package Manual Part 2. This manual lays down a standardized, systematic and evidence-informed framework for revising health benefit packages covering service inclusion, rate setting, fiscal impact and implementation processes to support universal health coverage while ensuring financial sustainability. Designed as a practical guide for policymakers and implementers at the national and state levels, this document strengthens transparency, consistency, and credibility in PMJY decision making. So a big round of applause as we release the manual. Thank you to our esteemed dignitaries. We will now move to the release of the best practices compendium under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, a carefully curated knowledge document by the National Health Authority. I'll once again request Honorable Minister and all esteemed dignitaries to do the honors. This compendium brings together select practices from states and union territories that have demonstrated measurable impact in areas such as beneficiary identification, hospital engagement, claims management, grievance redressal, fraud control, and use of digital tools. Thank you to our esteemed dignitaries. Well, ladies and gentlemen, it's now time for a few MOU exchanges that will altogether strengthen collaboration in the areas of multilingual access, research support, and quality assurance. So the first MOU, these have been signed, we'll have the exchange now, is between NHA and Bhashini. I'll request Ms. Jyoti Yadav, Joint Secretary NHA, and Mr. Amitabh Nag, CEO Bhashini, to join on stage for the MOU exchange. Yes, they're talking about the multilingual access that this MOU will ensure. A big round of applause. Thank you so much. The next one would be between NHA and Indian Institute of Science, Bengaluru. I'll request Shri Kiran Gopal Vaska, Joint Secretary, NHA, and Professor Fernendra Yalavarthi from ISC to please join on stage for the MOU exchange. Both the gentlemen joining in on stage, strengthening collaboration and research area. NHA and Indian Institute of Science, Bengaluru. Thank you so much, gentlemen. The next one would be NHA and National Accreditation Board for Hospital and Healthcare Providers, NABH. The MOU was signed between CEO NHA and CEO NABH, so I'll request Dr. Banwal to step forward, and from NABH, could I request Joint Director Dr. Kashipa Harit to please join on stage. Dr. Kashipa, yes, is here with us, Joint Director from NABH, National Accreditation Board for Hospital and Healthcare Providers. Well, ladies and gentlemen, the applause can be a little louder. Thank you so much. Well, ladies and gentlemen, that brings us to the end of the inaugural session. We would like to take this opportunity to thank Honorable Minister Dr. Mukesh Mahaling and all our esteemed dignitaries who joined us for the inaugural session. Before we move to the technical presentations, we'll request our esteemed delegates and esteemed guests on dais to please proceed towards the swimming pool area for now a group photograph. The arrangement has been done. It's just adjacent to this building. When you step out, it's towards your right. Oh, yes, sir. The felicitation. Yes, sir. Of course. Yes, we would like to, I'll request delegates to please stay back. We would like to felicitate our esteemed guests on dais from both NHA and the state side. So I'll first request CEO NHA, Dr. Sunil Kumar Banwal, to felicitate all our esteemed guests, starting with the Honorable Minister. This is from the NHA family, and then of course we would also like to do the honors from the Odisha family. Memento and a shawl. I'll also request him to felicitate Principal Secretary Srimati Gayatri Ji from Rajasthan. I'll request sir to do the honors. Felicitate both the Principal Secretaries. Yes, Srimati Gayatri Rathore Ji. Thank you so much. We'll also request him to felicitate Principal Secretary Shri Sampat Kumar Ji. A big round of applause. And we'll also request him to felicitate Commissioner Cum Secretary, Government of Odisha Health and Family Welfare Department, Srimati Aswati S. Felicitation from the NHA family to all our esteemed guests on dais. And now one more felicitation from the Odisha family side. So I'll request Commissioner Cum Secretary, Health and Family Welfare, Government of Odisha, Srimati Aswati S.G. to felicitate first our Honorable Minister and We would like to mention here that the token of appreciation being presented here on dais is made of silver filigree. It's a Cuttack chakra, as you can see. It's a famous silver filigree work from Odisha, 500-year-old century, made of silver wires. I'll request her to felicitate Principal Secretary for Medical Health and Family, to CEO National Health Authority, Dr. Sunil Kumar Banwal. A big round of applause to the Principal Secretary for Medical Health and Family Welfare, Rajasthan, Srimati Gayatri Rathore. To the Principal Secretary for Health and Family Welfare, Meghalaya, Shri Sampath Kumar. The silver filigree art. Thank you so much. Once again, we would now request all our esteemed guests on dais and our delegates to please proceed towards the swimming pool area where a seating arrangement has been done for a group photograph. It is a building right next to this. So once you step out, you'll have to take a right and then you'll find the swimming pool. I'm sorry, I don't know how I get this on stage. Never ever. I'll of course request pose the photograph for all delegates to join back for the technical presentation. Volunteers who are here, if you can please go outside and ask people to come inside and take their seats. We'll be moving forward with the technical sessions. I'll once again, and we would like to stick to the time schedule so that all of you can get a break and then come back later in the evening for a beautiful cultural evening that has been specially organized for all of you. Already Commissioner cum Secretary, Government of Odisha, and our Honorable Minister, both of them have given this request to all of you to soak in the cultural spirit of Odisha, do some shopping if you can. There is an Utkalika stall that has been set up for all of you as well. So it's important that besides the intense discussions and deliberations that happen over these 2 days, you also take advantage of being in India's best kept secret, the state of Odisha. We plan to finish technical presentations by 5 p.m. latest so that everybody can relax, come back for the cultural evening that has been planned near the poolside, the same place where the group photograph was done. So we need to start with the presentations. So I'll once again make a humble request. Delegates who are still outside, if you could please come inside and take your seats. I'll once again make a humble request. All delegates who are still outside, I'll request all of you to please come inside and take your seats. We would like to start with the presentations. We'll have tea breaks in between as well. Professor, for ISC. Yeah. ISC, NHO collaboration. Yes. Chief Executive Officer, National Health Authority, Dr. Sunil Kumar Banwal, Principal Secretary from both Meghalaya and Rajasthan, as well as Commissioner Secretary, Health and Family Welfare Department, Government of Odisha, will be seated here while we start with the technical presentations. All of them are joining in. Of course, the mandatory request once again, please do keep your mobile phones in silent mode before we begin with the technical presentations. Ladies and gentlemen, just a quick announcement. We were supposed to have a tea break after a few of the presentations, but since the tea is being served and people are anyways enjoying a hot cup of tea, in case some of you still want to do that, you can quickly grab your cup of tea and have a tea, because we don't plan to have any further tea break. Once we start with the presentations, we'll probably continue till we have the lunch break. So in case some of you have missed grabbing your cup of hot tea, you could do that right now. Since tea is being served right now. Well, we'll be requesting our esteemed delegates who have had their cup of tea or coffee. We can request you to please come inside, take your seats. Even if you can you can grab your cup of tea and bring that here, settle down with it. I'm sure the So we are running slightly behind schedule, and we would like to start as soon as possible. So we'll request everyone, once you've had your tea or coffee, kindly do come inside and take your seats. Well, I'll once again request all our esteemed delegates, if you have finished your cup of tea or coffee, can you please come inside, take your seats? I'm sure while stepping out for the group photograph and now also for the tea break, you would have seen the stall set up by Utkalika right outside, just after the tea stall, in fact. And I'll, of course, request everyone, whenever you have a time, there's a bit of a break, do take a look and maybe carry a piece of Odisha with you when you are leaving from this beautiful city of temples. So we are all set to start with our presentations. I'll once again request everyone to please come inside, get settled. All right, ladies and gentlemen, we are just about to start now. So I'll once again request everybody to kindly take their seats. We'll be starting with the technical sessions. I'll make a humble request now to everyone here in the hall to kindly take their seats. And once again, with a lot of humility, please do keep your mobile phones in silent mode before we begin with the technical sessions. So Chief Executive Officer, National Health Authority, Dr. Sunil Kumar Banwalji will be joining in along with the secretaries from all the 3 states, Meghalaya, Odisha and Rajasthan. We hope you've enjoyed your cup of hot tea or coffee. Principal Secretary for Medical Health and Family Welfare, Rajasthan, Srimati Gayatri Rathorji is here again. We'll request her to join here. Yes. All our delegates should be joining in any moment now. And we'll be starting with the technical session. We'll be starting with 2 back-to-back presentation, followed by the progress and update session for both the flagship initiatives. So I'll request Principal Secretary for Medical, Health and Family Welfare, Rajasthan, Shrimati Gayatri Rathore ji to join here. Our other delegates will be joining very shortly, but we are good to start with the technical presentations, ladies and gentlemen. I'll once again make a humble request in case you have kept your mobile phones back in action mode to put them into silent mode again. So we'll now move forward with the technical and review sessions for the day, beginning with focused presentation that will help us deepen our understanding of innovation, language access, and digital enablement within India's public health ecosystem. To begin with, we have a presentation by the Indian Institute of Science, Bengaluru, one of India's foremost institutions for scientific and technological research. The presentation will highlight key insights relevant to digital health system and innovation. May I invite Professor Phanindra Yalavarthi from IISc to kindly take forward this session for his presentation on IISc and NHA collaboration. Let's welcome him with a round of applause.
Thank you very much. Slides, please. I would like to thank Vikram here, who has invited me to be part of this NHA. We are very, very excited about this. Again, my name is Phanindra Yalavarthi, and I am a faculty member at Computational and Data Sciences. And what I'm going to present is that I'm going to present about a little bit about IISc, little bit about the AI Center of Excellence in Healthcare at IISc, and then a little bit about the solutions, and then I'm going to end up with the collaboration we are doing with NHA on the problem of chronic kidney diseases. Again, I just want to acknowledge here that our AI Center of Excellence, our IISc, comes under Ministry of Education, even though this is largely by Ministry of Health. And I would like to also thank IISc for giving us this support, as well as I'm representing IISc here, and as well as NHA for enabling this collaboration. Again, those of you who doesn't know IISc, so IISc is one of the oldest public-private partnership institution in the history of India. Jamshed Tata, who was conceived the IISc, donated funds to establish it in collaboration with Government of India at the time under the British rule, and Mysore royal family, which gave 370 acres of land, which is in the prime land of Bangalore. So we are located in the prime location of Bangalore, and it has been in existence in the last 115 years as a public-private partnership. We have a lot of legacy in terms of excellence in science and technology, starting from C.V. Raman, who served as the director, to all the way till Vikram Sarabhai, Satish Dhawan. So we have a lot of legacies around the scientists whom we have trained, who had been the directors, who had been there as a part of the faculty members of the IISc. And we also boast ourselves as the world-class research facilities, starting from basic sciences to like a nano center. We also have the second largest supercomputer in terms of the computation, 3.3 petaflop computer. We also do quite a bit of infectious disease research, having BSL-3 and viral BSL-3 labs. We also have a lot of imaging facilities. We are also going to have a new medical school that is going to come up in about a year time, which is 830-bed hospital as well. Again, I just wanted to point out, if you have not heard of it, we are always ranked the #1 university in India. Under the National Institute Ranking Framework, we are always ranked #1 university consistently for the past 10 years. And we are also #1 research institute consistently in the last 3 years under the NIRF framework. And we have the pillars of strength is that we have deep expertise in the AI, and then as well as the computation. And as I mentioned, we are also going to build our own in-house clinical expertise with Tata IISc Medical School, which is again a 2,000 crore setup where we are going to have both hospital and medical school integrated. And this is also going to be first such institution where we have both clinical sciences, that is medicine, engineering, basic sciences coming together, which is not very common in the Indian setup. And again, I also wanted to say that the Bangalore has been the biotech and health tech hub. So we also have long-lasting collaborations with the healthcare companies, and we think that we are going to move forward with it. So again, today we have signed a MOU with NHA. One of the partner of the MOU is Foundation for Science and Innovation and Development. We call it as FSID. And it's a Section 8 company registered under the Companies Act. and IISc is a founding member. It actually promotes what we call it as deep science and technology to develop scalable solutions, which serves under the IISc umbrella of things. In fact, we have agreements with FSID, which has run about 1,200 research projects in the last 5 years with more than 250 companies, let them be PSUs, let them be even MNCs, where we work largely on developing these deep tech solutions. So coming back to why I'm here is that those of you who didn't hear, there are 4 AI centers of excellence which government has established in the last, I will say, 1.5 years. One of them is in the agriculture, one of them is in the education, another one in sustainable cities, and the 4th one is in the healthcare. Of course, what is relevant here is the healthcare, which is established at IISc Bangalore, and we call our AI Center of Excellence as TANU, and we focus on primarily on building AI solutions for non-communicable diseases. And we are a center of excellence for the healthcare, which is funded by Ministry of Education. Ministry of Education oversees our AI COE. We are operated as a not-for-profit Section 8 company, and we are located in IISc, and it's a company by guarantee. That means that we are supposed to develop these solutions and then not make any profit out of it. And again, I just wanted to point out that we were awarded COE on July 3rd, and then we got it registered on October 3rd. And then we also have a mandate. The funding is for 4 years with an outlay of about 310 crores. And then in November, we also got a private funding from Google, which is given to us as an unrestricted grant for us to scale up our solutions. I'm going to talk about solutions in a while, what we do in this. Again, I need not tell you, a lot of you know already NCD's burden on India. Currently, NCDs account for more than 70% of the deaths, and large proportion of them are preventable if you are able to catch them early and then put them under proper management. So our whole aim of our AI COE is that we want to build AI solutions, what we call it as, for the frontline health workers. So this is a diagram which shows continuum of care. There are general populations, there are individuals at risk. So they decided to seek the care. Again, when we say they decided to seek the care, this might be the health camps which are being run, this might be door-to-door surveys which are being done, these might be walking into primary health centers, and they arrive at first point of care and then get a preliminary diagnosis done. And if the preliminary diagnosis is positive, they move up the chain, either come to a community health center or a district health center, and then get a definitive diagnosis and get into the care system. And our main aim of the Center of Excellence is to build AI solutions which are at the point of care. And at the point of care, mainly this point of care tends to be catering to the frontline health workers. So our AI solutions are facing frontline health workers, not really facing the patient, not really facing the doctor. So these are meant for frontline health workers. Again, so when I say NPHWs, we call them as non-physician healthcare workers. These could be nurses, these could be ASHA workers. They lack this specialized knowledge for the NCDs, and they also have resource constraints, and they don't have diagnostic tools. Could AI come and become the equalizer for them to build into this? Again, so one of the primary, there are 3 themes for us when we develop these solutions. One is that whichever solution we bring in, we bring it as an offline first. So that means that these have to work in a remote location without having any connectivity. So that means that all the AI solutions should run natively on the edge devices. So that means that these could be phones, these could be tablets, whichever are there in the hands of the frontline health workers. So they should be able to work with this. And then we also have a focus on the NCD part, such that we are addressing the non-communicable disease burden that is growing rapidly in the current healthcare system. And when we design such a technology, we call that as, you can think about like an app. So we also want it to be very, very intuitive, such that, remember that the ASHA workers' current qualification is 10th pass or 12th pass, depending on which state you see. So that means that they don't have that much digital literacy as you can expect them to have. So can there be a multilingual guidance so that we can reduce the training needed for this healthcare worker? Can this work gesture-based? So that these are very, very intuitive for us. So that is what is our primary aim as well. And again, when we bring these solutions to the healthcare workers, what we wanted to do is that our training data for the AI solutions has to come from what we call it as tertiary centers. So these are primarily physicians' expertise is what we want to approximate using AI, and then develop those tools and give it in the hands of frontline health workers, such that we are augmenting the frontline health workers or NPHW's knowledge. We are supporting their role so that we can improve the primary care. And I'm going to show you a couple of solutions around that as we go along. So these are the 5 solutions we are going to develop in the next 2 years, starting from oral cancer, breast cancer, retinal care, diabetes management, and mental health. And again, we have faculty members in IASC who lead such an effort across the spectrum of these things. I'm going to show you a couple of examples. What are these solutions, each one of them mean in a while. Again, when we develop these AI solutions, one of the points that is always get missed out is that what is the rationality for such a solution, whether it works, doesn't work in the system. So one of the things which gets missed out a lot is that every AI solution is considered as a software as a medical device. And then SAMDs get actually certified or licensed like regular medical devices. And currently under the medical device bill, which was passed in 2020, so software has been included as a medical device. So that means that any AI solution we are going to bring out, in fact, there is a certification process to get it from CEDASCO. And so that means that we can get the certification done using CEDASCO. And then we also have a mandate as a center of excellence to deploy it as a digital public infrastructure. So that means that all the AI solutions which we are going to develop will be available for public, especially in the public infrastructure framework for easy deployment. So let me show you one example of this. So this is the work which we have been doing for the past 2 years. So this is a very simple point of care mobile phone based oral cancer screening. And probably India is one of the very few countries where chewing of tobacco is rapidly increasing. And in fact, it has become a large issue. And then because of chewing of the tobacco, they get this what is called as pre-malignant lesions, or you can call this as precancerous lesions. And detecting them is an extremely tough task. So what we have is a simple mobile application which can take the photographs of the oral cavity, and our AI runs behind on the mobile phone, and it will give you 3 outcomes. If the photograph is not taken properly and has errors, it will say that retake the photograph. If it finds anything suspicious, it will say that refer it. And if it really doesn't find anything, it will say that routine follow-up. When we say referral, they move up the chain, come to a district center or a community health center, get a biopsy done for a definitive diagnosis. So if at all you don't want to use the AI, then you have to do what is called as oral visual examination. Then again, you have to train the frontline health workers how to do oral visual examination. And remember that India holds currently 1/3 of the oral cancer burden globally. And the burden on the system is much more when you detect it very late. And here is where we are trying to detect them on the pre-malignancy stages, such that we can do the intervention. We can also really give them counseling such that we can improve it. In fact, this is already rolled out in 9 sites across 6 states. We also have a referral pathway which has been established at the community health center in automated fashion. And then we are also collecting more and more data and trying to validate it. Similarly, in other applications of breast cancer and as well as the retinal care, we have similar applications which are very, very simple, which are intuitive for the frontline health workers to use so that we can do this triaging in a very effective way. So again, this app, at least the oral cancer app, has been won many awards. One of the recent one we got it is in the Indian Mobile Congress. We have won the Best Education Institute exhibit. So the app is called as Arogya Arohan. In fact, it is available on the Play Store. You can download it without AI because we have not yet got the certification from the CEDASCO. So we want to get the license from the CEDASCO and then roll it out as a part of our platform as well. So the one which we are doing with NHA, I would like to point out this kidney failure or the renal health is a big problem even for NHA. Currently, close to about 14% or 15% of NHA budget goes for the dialysis. And then one of the primary thing is that you do dialysis because they are in the CKD or chronic kidney diseases. And the risk factor, what is called as KFRE, which is kidney failure risk equation, that actually predicts the CKD progression to what is called as end-stage kidney disease. So that means that this is about 2 to 5 years they take to come to an end stage of the kidney disease. And these KFRE is currently calculated based on 4 factors. One is age, sex, EGFR, which is filtration rate, and then other one is albumin to creatine ratio. There is a 4 variable model. And KFRE has been used in identifying what is called as high risk patients for the effectively doing the nephrology referrals. So in fact, should you do them dialysis, how frequently should they get dialysis, and even interventions like ACE inhibitors, which are the medications which are given, reducing unnecessary consultations, those who are not at high risk, and even the late stage crises of having a complete failure. And the problem of the KFRE is that most of the KFRE currently, the way it is calculated is based on Western data. Actually, it is based on Canadian data. So there has not been any study or recalibration done KFRE for the Indian population. And also remember that the ACE inhibitors we use in our health system is also very generic medication. So we have to do recalibration, and we also have to look at it, how the patient trajectories have been. So this is where we want to take the help of NHA. NHA has more than close to about 20 lakh patients data, which longitudinally has been there for 2 lakh for 2 years. So we want to analyze that data, build AI model for automatically doing that calibration, doing population specific KFRE for us, so that we can establish that referral pathways in a more effective manner and then build around this. That is what is our aim is. So again, I'm not going to go into the details, but the primary aim here is we want to recalibrate the KFRE model, which is very specific to the particular population. It could be state level, it could be ethnicity level. So we want to look at that gap which exists right now, and then do this analysis such that we can do a very effective renal health outcome. So that is where I think I'm going to stop. And again, even though I'm representing here as the Chief Project Manager, but there are other faculty members who work in this. We have a good team around IISc. And then we also have a good executive team, Rahul here, who is the current COO, Chief Operating Officer for our Tanu, who executes a bunch of our project. And again, I would like to thank NHA for giving this opportunity. But I also have an appeal for all of you. So we are looking for good medical partners to develop and deploy some of these AI solutions in the primary deployment phases, including frontline health workers, for improving this NCD care. So if you have any referrals for us, or if you want to collaborate with us, we'll be very, very welcoming. And my email ID is right there. Please do write to us. We'll be very happy to really do this collaboration. Thank you very much.
Just see, for the benefit of everyone, you need to see the value this IISc brings. You may be knowing IISc has got a AI Center of Excellence for health only. So AI Center of Excellence, which was approved by Ministry of Education, Government of India, worth 500 crore. So they have deployed full team, and they have created a Section 8 company called Tanu, which he is heading. In this, all possible AI solutions need to be developed. Now, no AI solution will be perfect unless they are tested on Indian data sets. Now, they are also looking for the states, where states will be coming forward to share data on which they can test the solutions. Right now, PMJ data we are sharing for the dialysis, for testing the solutions they develop, and they will develop solutions for our frontline workers also, which can do the triage whether the case is fit for kidney problems, referral, etc. So my request to all of you would be, though we are already coordinating as NHA with IISc, it's better if individual states also coordinate with the IISc for their state-specific requirement. And they are more than happy to collaborate with you all to whatever best they can give. So I think those states who are already generating good digital data, and at least PMJ data is there with every state, they can take advantage of it. And I'm sure the way Phanindra is working on it, every state will get benefit. And I think one of the things we were also working at, like for now, as we all know, AI is going to be there, whether we like it or not, and more so in the health, because so many advantage will come out of it. So the good thing is you start identifying in each state some of the premier institutions, technical institutions like IITs, NITs, with whom you can work. Like Odisha can work with IIT Bhubaneswar and AIIMS Bhubaneswar. Similarly, every state has got some premier technical institutions. So they may be otherwise also working on AI and technology, but if you coordinate, they will specifically also work for AI in health. And there, I think IISc will also help, because they are also supposed to build capacity of other institutions. So let us take advantage of this. I was seeing in UP, they tied up with IIT Kanpur, and now they have developed AI solution for mass screening of cataract. Similarly, they are also developing a solutions for screening of oral and breast cancer. So many more such solutions can come up if you tie up with the local technical institutions, which otherwise also working on these technologies. So that is one request, I think.
Thank you, Dr. Sunil.
Yes.
So CEO of NH has been very, very proactive, and then, in fact, I have to say this, that within 1 month, with NHA collaboration, we have moved very far. In fact, today we have signed the agreement with them for the data sharing and as well as doing the AI solution. One of the primary thing I wanted to point out is that even though the AI as a technology exists, so we call this as a fine-tuning problem. The fine-tuning problem is that unless you have a local data, unless the solution has been fine-tuned for the local setting, no AI is going to work in the field. So this is what we call it as fine-tuning problem of AI. And in fact, I would request every one of you so to collaborate, like Dr. Sunil has already mentioned for us, so such that we can develop these solutions, do this fine-tuning, and also deploy it for the common good. Thank you very much.
Thank you, Professor Phanindra, for that wonderful presentation, and to Dr. Banwal for highlighting how states can take advantage. Before we move to the next presentation, I'll request Principal Secretary for Health and Family Welfare, Meghalaya, Shri Sampat Kumarji, also to join in here. Thank you. So we move to our next presentation by Bhasini, India's AI-powered language translation program under the National Language Translation Mission, which aims at enabling seamless access to digital services across India's diverse linguistic landscape. For this presentation, I'll request Mr. Amitabh Nag, CEO of Bhasini, to please join in. The presentation is on advancing digital health with AI innovation and inclusive language access. Let's welcome him with a round of applause.
Thank you very much, and special thanks to National Health Authority for having me here to discuss about what Bhasini can do in digital health, as well as once the digital health happens, once the things are digitized, you of course move towards AI, and obviously making it multilingual so that everybody, there is no barrier as far as language is concerned. I belong to an organization called Digital India Bhasini Division. Digital India Bhasini Division is an independent business division under Digital India Corporation, which is a Section 8 company of MeitY, that is Ministry of Electronics and Information Technology. We are currently working with, these organizations who have footprint on healthcare, and I would during my presentation, try to touch upon various aspects where we are working upon them, and also emphasize the fact that this is a co-creation platform for enabling voice-first multilingual applications. Bhashini was, launched in 2022 as Digital India Bhashini Mission by Honorable Prime Minister in Gandhinagar Digital India meet. And at that point of time, it was thought that we would be basically looking at bridging the language barrier so that the language does not become a challenge for anything. We had 5 set of problems. The first problem was that the digital system should be able to automatically recognize your voice and code it. So, as I speak, for example, it should be able to transcribe what I speak. So that is automatic speech recognition. And that too in 22 languages to start off with. Then we were looking at the second thing, which was text-to-text translation. That means if I'm right now speaking in English, and it is getting transcribed, it should also get, translated into Odia. So that is text-to-text translation. That is the second problem statement which we were working upon. The third problem statement was that the digital system should be able to speak to you. That means, and that too in 22 languages, that is text-to-speech. So that means if I have something, the digital system should be able to speak in Odia, for example, or speak in Telugu, for example, if there is an encoded text in Telugu. Then there were a lot of printed text which were there, which were in different format. If you scan that, that would be either a .png or a .tiff file, which will not be machine readable. And our job was to convert them into a machine readable format. And that was the fourth problem which we were looking at. The fifth problem was that even though we are a lot digital, in a lot of ways, still our data dictionary is not built up in a digital format. It is still in our print, or it is still in our mind. And a lot of words, names, etc. are not part of digital systems. So how would digital systems be able to recognize it if it hasn't seen it? Mind you, AI is like a child. If a child reads 100 books, he is as intelligent as 100 books. If he reads 1,000 books, he is as intelligent as 1,000 books. So you need to provide data for the AI systems to read and understand. So similar is the case with when we are building the language models. When we started building
को सामना करते सीडीए बासिंदा निश्चित रूपे गोटे बड़ अघटन को एडे दिगले आप देखते गेल कर्मचारी अधिकारी मान सब रही कार्य करते समय लगे तो कही होनी किंतु पाइपलाइन संपूर्ण भाव सजड़ा हला स्वाभाविक यही रास्तार उभय पट को बंद कर दिया कहीं लोक मैंने यातायात कले कम कर बाधा सृष्टि हो लोक मैंने
बिल्कुल किरण जिते गैस टांकी फाटुची पाइप फाटुची लोकंक भितर भय रहा स्वाभाविक किंतु स्थिति नियंत्रण भितर रही एसपी भी सूचना रखुंट बहुत बहुत धन्यवाद कटकरू किरण कानूनगो रही जी के प्रसंग अधिक सूचना देउथिले। आजिठार भारतीय जनता पार्टी राष्ट्रीय अध्यक्ष निर्वाचन प्रक्रिया आरंभ। आज अपराह्न 2टारू 4टा मध्य अध्यक्ष पद पर नामांकन दाखल हेब। अपराह्न 4टारू 5टा मध्य नामांकन पत्र जांच प्रक्रिया रही। संध्या 5 भाव नामांकन दाखल करिपारंती। नितिन नवीन एवं बीजेपी कार्यकारी अध्यक्ष रही। प्रधानमंत्री नरेंद्र मोदी नामांकन प्रक्रिया समय प्रस्तावक भाव में उपस्थित रहिबे बोली आशा करा जाउछि, जहां दलर सांगठनिक कैलेंडर में एक हाई प्रोफाइल कार्यक्रम करिबो। नूतन बीजेपी अध्यक्ष आनुष्ठानिक घोषणा आसंता काली कराजिबार कार्यक्रम रही। राजनैतिक पर्यवेक्षक माने ए घटनाक्रम उपर तीक्ष्ण नजर रखिछन्ते, कारण ए नियुक्ति एक गुरुत्वपूर्ण समय आसीछि जेतेबेले बीजेपी यार सांगठनिक शक्ति को मजबूत करिबा एवं दीर्घकालीन शासन उपर ध्यान देउछि। 5 थर बिहार विधायक नितिन नवीन को डिसेम्बर 14 बीजेपी कार्यकारी सभापति नियुक्त करा जायतिला। कार्यकारी सभापति भाव में नियुक्ति परठारु नवीन विभिन्न राज्य गस्त कर दलीय सहकर्मी को भेटिछन्ति। आसंता काली आनुष्ठानिक भाव घोषणा कराजिबो नुआ अध्यक्षक ना। दिल्ली मुख्यालय उपस्थित रहिबे बीजेपी शासित राज्यर मुख्यमंत्री, सबु राज्यर सभापति और वरिष्ठ नेतांक उपस्थिति रे ना घोषणा कराजिबो। जम्मू कश्मीर किश्तवाड़ में आतंकवादी और सुरक्षा बाहिनी मध्य जोरदार गुलीगोला विनिमय एथिरे सेनार 8 जन जवान आहत होइछन्ते 3 जन को चिकित्सा निमंते एयरलिफ्ट कराई हॉस्पिटल रे भर्ती कराई घटना किश्तवाड़ जंगल अंचल सोनार रे घटिछि एटारे आतंकवादी विरोध में भारतीय सेनार ऑपरेशन त्रासी जारी रही गतकाली ऑपरेशन समय आतंकी सहित अचानक मुहांमुही होता उभय पक्ष परस्पर उपर गुलीमाड़ करते 2 ରୁ 3 जन आतंकी को जवान माने घेरी एही समय आतंकी माने ग्रेनेड माड़ करते एमाने जैश ए मोहम्मद सदस्य बोली अनुमान करा घटना पर तलाशी अभियान जारी रही ड्रोन द्वारा तमाम अंचल में छानबीन चली जम्मू कश्मीर किश्तवाड़ में एभली एक घटना घटी जो फल भारतीय सेनार 8 जन जवान आहत होती किछि सेना मानकर चिकित्सा निमंते सेमानकु एयरलिफ्ट भी करा जायछि। परवर्ती खबर पर नजर पकेबा ईरान संकट मध्य अधिक प्रभावित होउछि भारत गोटे पटे सेठारे रहउतिबा भारतीय माने भयर अछंती तो अन्य पटे भारतरु ईरान को बासमती चाउल रप्तानी उपरे प्रभाव पड़िछि सेठारु कोनोसी नुआ रप्तानी ऑर्डर आसु नाही या सहित पूर्वरु जे चाउल पठा जायछि तार पेमेंट भी आसी पारु नाही चलित आर्थिक वर्षर एप्रिल नवेम्बर मध्य ईरान को प्राय 5.98 लाख टन बासमती चाउल पठा जायतला किंतु सेठारे चलिथिबा संकट जुगु ईरान क्रेता माने पेमेंट करिबारे सक्षम होउनांती तेहरान रे जेबेठारो विरोध प्रदर्शन आरंभ होईछि ईरान रे दुकान बाजार बंद रहिछि इंटरनेट संजोग भी नाही एबळी स्थिति रे क्रेता मानक सह संपर्क होई पारु नाही खाली सेति कि नुहे भारतरु जे चाउल के पूर्वरु पठा जाउथिला ताहा ईरान बंदर रे फसी रहिछि नुआ ऑर्डर न आसीबा पर्यंत बा न आसीबा कारणरु भारतीय रप्तानीकारींकर चिंता बढ़ी जाइछि। समय ब्रेक खूब शीघ्र फेरुछु।
किए से आसिला लीकेज असुर सीए एबे पळैबो मालिक एबे आरंभ हे जाऊ इंडिगो प्रोटेक्ट प्लस संपूर्ण वाटरप्रूफिंग समाधान लीकेज को लॉक करे
राजनिवास स्वाद जहाँ करे राज
ऑफिस रु बाहर
कौन हला
अंटारे दरज आरु आरु
तुमर अंटारे दरज अछि
मूव खूब शीघ्र मेसी जाए उष्मता आने तो दरज को दूर कर प्रियजन पाई मूव कर
न्यूज 7 रे खबर प्रसारण पर चेतिला जाजपुर प्रशासन रास्तार सफायला बाली घटुची अनेक दुर्घटना रे अनेकंक जीवन जाउछि तेबे किपरि दुर्घटना न घटिबो रास्ता पर पड़िथिबा बाली हटिबो से ने प्रयास आरंभ करितला न्यूज 7 आ आज तार प्रभाव देखिबा को मिलिछि खबर बाजिबा परे जाजपुर जिला प्रशासन चेतिछि और रास्तार सफा होउछि पड़िथिबा बाली जाजपुर शहरर मुख्य रास्ता पर बाली पड़ी रहिथिबा कारणरु अनेक दुर्घटना घटी जीवन जाउथिला हेले प्रशासन नीरव द्रष्टा साजिथिला आ सेही रास्ता को आज ठिकादार साहाय्य सफा करा जाउछि तेबे किपरि चलिछि रास्ता सफा से ने अधिक सूचना देउछंती सीनियर रिपोर्टर सुरेंद्र श्यामल
खबर बाजिला आ चेतिला जिला प्रशासन रास्ता कड़े बाली पड़ा जो अनशन चेती एवं ता सहित देखुए रास्ता कड़े जो बाली को किभली सफा कर सीधा सब दृश्य देखा ये हूँ से दृश्य जो रास्ता कड़े पूरा बाली पड़ी एवं से रास्ता कड़र बाली को बर्तमान सफा कर ये हूँ जाजपुर सहर दृश्य में देखा जो बर्तमान ट्रैक्टर
चक पर्यंत बहुत लोक पड़ी आंठु गंठी छिंडुला गाड़ी फाड़ी भांगी जाऊला এটা କରିଦେଲେ ଫଳରେ ଲୋକମାନେ ସୁବିଧାରେ ଯିବା ଆସିବା କରିବେ।
ବହୁତ ଥର ୟାକୁ ନେଇ ଖବର ପ୍ରସାରଣ ହେଲା, ଅଭିଯୋଗ ମଧ୍ୟ ହୋଇଛି, କିନ୍ତୁ ଏବେ ଖବର ପ୍ରସାରଣ ପରେ ପ୍ରଶାସନ ଚେତିଛି।
ଆଜ୍ଞା ଆଜ୍ଞା ପ୍ରଶାସନ ଚେତିଛି, କଲେକ୍ଟରଙ୍କ ଅର୍ଡର ଅନୁସାରେ ଏଟା କରାହଉଛି।
କଣ କହିବେ ଯେ ଭଲ ନିହାତି ଗୋଟେ ଯେହେତୁ ସଫା ହେଲେ ଲୋକମାନେ ଭଲ ଯାଇପାରିବେ ବାଟୋଇ?
ନିଶ୍ଚୟ ନିଶ୍ଚୟ ଆଜ୍ଞା, ସଫା ହେଲେ ବାଟୋଇ ମାନେ ଆରାମରେ ଯାଇପାରିବେ। ଏ ଯୋଉ ସଡ଼କ ଦୁର୍ଘଟଣା ହଉଛି ଗାଡି ସ୍ଲିପ୍ ହେଇକି ସେଇଠାରୁ ଆପଣ ରକ୍ଷା ପାଇଯିବେ ଲୋକମାନେ।
ଯଦି କହିବା ଯେ ରାସ୍ତାରେ ପାଖାପାଖି ଗୋଟେ ସୋରା ପୁରା ରାସ୍ତା ଯୋଉ ଗାଡି ବାଲି ଗାଡି ଯାଏ ସେ ଗାଡିରୁ ବାଲି ପଡିକି ପୁରା ରାସ୍ତା ପୁରା ଜାମ୍ ହେଇଥିଲା, ଯୋଉଥିରେ କି ଅନେକ ଦୁର୍ଘଟଣା ଘଟୁଥିଲା। ଏଇ ବାଲିରୁ ଅନୁମାନ କରାଯାଉଥିବ ଯେ କେତେ ମାତ୍ରାରେ ବାଲି ପୁରା ଚୋଡା ହେଇକି ବସିଥିଲା। ଇଏ ଯେତେବେଳେ ଖବର ପ୍ରସାରଣ କରାଗଲା ଏବଂ ଜିଲ୍ଲା ପ୍ରଶାସନ ଚେତିଲା ଏବଂ ଶେଷରେ ଇଏ ହଉଛି ଶେଷର ଦୃଶ୍ୟ ଆମେ ଦେଖାଉଛୁ। ପ୍ରଶାସନ ଚେତିଲା ପରେ ବାଲି ବର୍ତ୍ତମାନ ରାସ୍ତାରୁ ହଟୁଛି। ନିହାତି ଭାବରେ ଆମେ କହିପାରିବା ଯେ ଏହାପରେ ଆଉ ଦୁର୍ଘଟଣା ନ ଘଟୁ ଏବଂ କାହାରି ଜୀବନ କାହାର ନ ଯାଉ। ଇଏ ହଉଛି ସେଇ ଦୃଶ୍ୟ, ଯେହେତୁ ବର୍ତ୍ତମାନ ଆସ୍ତେ ଆସ୍ତେ ସଫା କରାଯାଉଛି, ମ୍ୟୁନିସିପାଲିଟି ପକ୍ଷରୁ ସଫା କରାଯାଉଛି ଏବଂ ତା ସହିତ କିଭଳି ଭାବରେ ଆଉ ଦୁର୍ଘଟଣା ନ ଘଟିବ ତା ପାଇଁ ମଧ୍ୟ ସଚେତନ କରାଯାଉଛି।
ବହୁତ କିଛି ଏଠି ଅନେକ କିଛି ବାଇକ୍ ଫାଇକ୍ ଠୁ ନେଇକି 4 ଚକା ଠୁ ନେଇକି ସବୁ କିଛି ମାନେ ଆଜ୍ଞା ଦୁର୍ଘଟଣା ହଉଥିଲା। ତେଣୁକରି କଲେକ୍ଟର ପ୍ରଶାସନ ଇଏରୁ ଆମେ ସଫାସୁତୁରା କରୁଛୁ ପୌରପାଳିକା ହିସାବରୁ। ଆଜ୍ଞା ଏତିକି ହଉଛି କଥା।
ଦେଖନ୍ତୁ ଯଦି ଆଗରୁ ସଫା ହେଇଥାନ୍ତା ହୁଏତ ଆଉ ଦୁର୍ଘଟଣା ଘଟିନଥାନ୍ତା କି ଦୁର୍ଘଟଣା ଘଟନ୍ତାନି।
ସେଟା ତ ଆଜ୍ଞା ଠିକ କଥା, ଯଦି ନିଟାଲଟା ସଫା ଥାନ୍ତା ଯଦି ଦୁର୍ଘଟଣା ଏତେ ଘଟିନଥାନ୍ତା ଆଜ୍ଞା। ତେଣୁକରି କଲେକ୍ଟର ବାବୁଙ୍କ ତରଫରୁ ମ୍ୟୁନିସିପାଲିଟି ତରଫରୁ ଆମର ସଫାସୁତୁରା ହବାଠୁ ଏବେ ଗାଡି ଗୁଡା ସୁରକ୍ଷିତରେ ଯିବେ। ଆଉ
କହିପାରିବେ କି ଯୋଉମାନେ ଗାଡି ବି ନଉଛନ୍ତି ବାଲି ଗାଡି ସେମାନେ ଘୋଡେଇକି ନିଅନ୍ତୁ, ଯୋଉଭଳି ରହିବା କଥା ସେଭଳି
ଆମର ଘୋଡେଇକି ନଉଛୁ ଯେ କି ବାଇକ୍ ଫାଇକ୍ ଯାଉ ଆଜ୍ଞା ନା ଆଜ୍ଞା ଘୋଡେଇକି ନଉନଥିଲେ ଆଜ୍ଞା। ଆଜ୍ଞା ଅନୁରୋଧ କରିବାକୁ ପଡିବ, କିନ୍ତୁ ତାଙ୍କୁ କୁହାଉଛି ଦେଖି ସେମାନେ ଯଦି ନ ମାନୁଛନ୍ତି ତାହେଲେ ଆମେ ଆଜ୍ଞା କଣ କରିପାରିବା।
ଭାବରେ ଶୁଣୁଥିଲେ ଯେ କିଭଳି ଭାବରେ ଲୋକମାନେ ଆଜି ଏଇଥିପାଇଁ ଖୁସି ଯେହେତୁ ଆଜି ରାସ୍ତାଘାଟ ସଫା ହଉଛି ଏବଂ ଯୋଉ ରାସ୍ତାରେ ବାଲି ପଡିଥିଲା ତାହା ଆଜି ଉଠା ଯାଉଛି ଏବଂ ନିହାତି ଭାବରେ ଗୋଟେ ଆମେ କହିପାରିବା ଯେ ଯାଜପୁର ସହର ପାଇଁ ଗୋଟେ ଦୁର୍ଘଟଣା ମୁକ୍ତ ହବ ବୋଲି ଆଶା ମଧ୍ୟ ରଖ।
ହୋଇଥିବା ଏହି ସୁବର୍ଣ୍ଣ ଧନୁ 30ଟି ଜିଲ୍ଲା ଭ୍ରମଣ କରି ପୁରୀ ପହଞ୍ଚିଥିଲା। पंचधातुरे निर्मित होइतिबा धनुर ओजन 280 किलोग्राम रही। आप देखिपुंट केभली भाव में पूजा अर्चना करा जाउछि। पुरी ब्यूरो चीफ चित्तरंजन महांती प्रसंगर अधिक सूचना आम सहित लाइव रे जोड़ी जाइछन्ति। चित्तरंजन श्रीमंदिर चतुर्पार्श्व परिक्रमा करुछि एही सुवर्णर धनुष एवं आज ही अयोध्या अभिमुखे यात्रा करिबो आज ही।
देखो नलिनी आप सीधा सड़क चित्र देखुंती देखो नलिनी आप सीधा सड़क चित्र देखुंती तीर एवं सेवक माने समस्त सेवायत माने भव्य स्वागत करथिले एई रामचंद्रकर उद्देश्य समर्पित होगा जाउथिबा अयोध्या ए धनु आ तीर को एवं एठारे जो श्रीक्षेत्र में रखा जाइथिला आज दिन 11:10 समय रे यार परिक्रमा आरंभ करा जाइछि। श्रीमंदिर चतुर्पार्श्व श्रीमंदिर जो परिक्रमा मार्ग रे याकू परिक्रमा करा जाउछि। समस्त साधु संत मानक सहित सेवक एवं ता सहित मठाधीश माने एई परिक्रमा रे समस्त यात्रा करुछन्ति एवं सबुठारु सौभाग्यर कथा सबुठारु दुर्लभर चित्रर कथा जे महाप्रभुंकर जो अपूर्व दृश्य तो निश्चित भाव में आप नलिनी देखिपे। आम टे निरंजन टे आग को आसतु जीवा कारण परिक्रमा यात्रा चली तार भितर आम टे चेष्टा करवा प्रतिक्रिया नापी तो समस्त परिक्रमा व्यस्त अच्छा तो निश्चित कहीपर ये जो दृश्य ये जो प्रभु रामचंद्र धनु आ तीर एठार आसी प्रभु श्रीकृष्ण निकट को आज श्रीकृष्ण अर्थात ये कलिजुग अवतारी महाप्रभु श्री जगन्नाथ निकट को श्रीक्षेत्र को आसी सीधा सड़क अयोध्यार अभिमुखे यात्रा कौन कहे आपण कि भाव में ये जो यात्रा आरंभ होइछि ए यात्रा केते भव्य केते दिव्य
एटा तो आपनकर बहुत ही भव्य पूरा ओडिशा सारा एटा बुले कि आमे आसीछु पुरी को और चारियाडे हमर पुरी रो परिक्रमा चलछि हमर भाग्य अछि कि ए जगह के हम परिक्रमा करि पारछु और मु राउरकेला रो आसी राजेश सिंह और सनातन जनरल मेंबर अछि और आमे सोन यात्रा को नै कि आमे अयोध्या को जिबु
तो ए 30 जिल्ला रे आपन को केमिति
बहुत बहुत भल लगिला बहुत लोक मान समर्थन है आमर से माने थिला कि सनातन जोड़ो कही आम थिला आ समस्त सनातनी माने एक है कि पूरा परिक्रमा करले सांगरे रहिले पूरा बहुत आमको आनंद लगला बहुत भल लगला
ए जो सनातन जो सचेतन यात्रा राउरकेलारू जो आरंभ होइछि प्रभु राम को उद्देश्य रे केते आपण सेही स्थान रु आसी केते आपण उपलब्धि करूछन्ती केते आपण को उत्साहित करू
लोक जगह जगह रे सबू डिस्ट्रिक्ट बुलिला आमे बुलिछु आ सबू डिस्ट्रिक्ट रे जो उत्साह देखिछु सनातन धर्म को नै कि एडा गुड मेसेज थिला समस्त सनातन
बिल्कुल चित्ररंजन वर्तमान समय एही स्वर्णर धनुष परिक्रमा करूछि जार पूरा विजुअल आपण सामना करनथिले बहुत बहुत धन्यवाद तमाम सूचना पाई परवर्ती खबर पर नजर पकेबा नुआपड़ा वीडियो को माड़ पंचायत गृह निर्माण को नहीं वीडियो रोहित भोई को माड़ होइतिबा अभियोग होइछि एने वीडियो थाना एतला देबा परे ब्लॉक परिसर रे एसडीपीओ सहित नुआपड़ा पुलिस पहुंची तदंत करिछि भैसाटाल पंचायत गृह निर्माण को नहीं विवाद लगी रही भैसाटाल पंचायत मुख्यालय हेबाकु थिबा पंचायत गृह बालोदा ठारे निर्माण हेउथिबाकु नेई विरोध करुथिले ग्रामवासी जांकु नेई वीडियो को माड़ मरा जायथिबा अभियोग होइछि
बंद करवा सत्ते भी से कहीं से कंस्ट्रक्शन काम चलते मुझे चालवा नहीं जाने मुझे सांगे सांगे जितना आसला मुझे जितने डिप्लो के लिए मुझे सांगे सांगे कम्युनिकेट करने बंद भाई रही जो से स्टार्ट हो फिर फोटो तो दिया है कहीं से निकला पता इे आउन अफिस आड़े बाटे पिलाटे गला और मरी पूरा नहीं आउ गोटे पिला गाँव लोग थे 10-15 जन थे गोटे पिला मो गाड़ी पिटेला
आज आम खरियाणी गाँव प्रशासन जुगाड़ के लगे सार घर के गाड़ीटा लगे भैसा तार 10-12 जन आसिले कथा नहीं बार्ता नहीं आज्ञा आज्ञा हठात आसिक पिटे आज्ञा हाँ तो चिन्ह आज्ञा ना कि मुझे नहीं जाने ताकि मुझे चिन्ह मुझे तो कही देखनी चाहूँ ऑफिस कथबार्ता है रास्ता कथबार्ता नहीं हूँ बोलिक से आणुली आज्ञा आउ जड़े बैक रू आसला आ हठात आज्ञा आगे आगे गोटे चापड़ता मैंने गाले गाले पिटी
काଣା କଥା होतले
होतले भैसा ताल आज्ञा से बंद नहीं हमार काम कहीं बंद नहीं हमार बोली आज्ञा संगे कथबार्ता होतिले तो सार कहले मुझे तो बंद करी चलून कहीं एमती होचन बोली घर सामने सब कथबार्ता होतिले आज्ञा
समय सरी बुलेटिन को एच रखुछु नमस्कार।
आपण स्वास्थ्य और सेवा उद्देश्य आम 24 घंटा आपण मान सहित और आपण मान सेवा हाईटेक मेडिकल कॉलेज एंड हॉस्पिटल भुवनेश्वर
केवल 35 वर्ष बयस शिवप्रकाश सर हार्ट अटैक आकस्मिक भाव में चलीगले टर्म लाइफ इंश्योरेंस रू मिलथिबा टंका तांको बापा मां को भविष्य में सहारा देबा क्लेम समय पॉलिसी बजार फैमिली को संपूर्ण रूपे सहायतार हाथ बढ़ाइथिला पॉलिसी बजार 1 कोटी हेल्थ इंश्योरेंस केवल 550 टंका प्रति मासरो आरंभ।
नमस्कार अति भल पाउथुबा आपण मानकर न्यूज चैनल न्यूज 7 आउ तार पुणी थरे आपणकर अति निजर भल पाउथुबा प्रोग्राम डॉक्टर को पाठशाला रविवार संध्या 8:30 बेले सबुथर परी एक नुआ अध्याय धरी मु आपण पाखरे आज पुणी प्रस्तुत अच्छी बसंत कुमार पति। एवं आज आमे चर्चा करिबा गोटे एंडोक्राइन ऑर्गन उपरे। एंडोक्राइन ऑर्गन होची सेई अंग शरीर जे कि आपण तो जानी थिबे भिन्न भिन्न हार्मोन आम शरीर सठिक रूपे चालना करिया पई उपस्थित अछंती। ता भितरु गोटे अति गुरुत्वपूर्ण अंग एंडोक्राइन ऑर्गन सेटा होची थायराइड। आजिर चर्चा हाइपोथायरॉइडिज्म ए विषय रे चर्चा करिया पई आज आमर उपस्थित हेबे जने सुप्रसिद्ध एंडोक्राइनोलॉजिस्ट डाक्टर प्रोफेसर स्वयं सिद्ध मंगराज। आसंतु स्वागत करिबा डाक्टर प्रोफेसर स्वयं सिद्ध मंगराज को। नमस्कार।
नमस्कार सर।
आईएमएस और सम हॉस्पिटल रो छात्र छात्री एवं डाक्तरंकर प्रश्न हम केवल जनसाधारण तरफ आउ उत्तर देवे स्वयं सिद्ध सार। ता पूर्व स्वयं सिद्ध सार हाइपोथायरॉइडिज्म विषय रे जनसाधारण किछि कहिबे।
आपण देखि पारते जोटा हम समस्तंकर गळारे अछि एटा को कोंती गोटे बटरफ्लाई ग्लैंड बिकॉज ता शेप टा हला गोटे बटरफ्लाई पळे एइथरु ही हमरो हार्मोन जोटा के हम शरीर पे दरकार T3 और T4 ए दिटा मेनली तयारी हुए जोटा की तार डिफरेंट काम थाए ऑर्गन सिस्टम रे। तो एटा हला ऑर्गन सिस्टम माने आपण बॉडी रो जे कोनसी मेजर ऑर्गन सिस्टम कथा कोंतु आपण ब्रेन कथा कोंतु हार्ट कथा कोंतु मसल कथा कोंतु बोन कथा कोंतु लिवर कथा कोंतु किंबा मेटाबॉलिज्म माने आपनकर वेट केमति नियंत्रण होउची एई सबु पछरे थायराइड हार्मोन रो इंपोर्टेंस रहिची। एई हार्मोन माने एई सिस्टम टाकू पूरा रेगुलेट करंती। जो गोटे सुस्थ लोक देहरे जेति की हार्मोन तयारी होबा कथा जदि सेति की परिमाण रे होउची ताले एई सबु ब्रेन हार्ट किडनी मसल लिवर वेट सबु फंक्शन नॉर्मल रहइबो। जदि डिजीज हेला हाइपोथायरॉइडिज्म हेला ताले एटा अफेक्टेड होबो। जदि आमे कथा हबा को सिम्पटम आमे जेमति डिस्कस करले को सिम्पटम हे पारे जेमति एक्सेसिव चुट्टी झड़िबा हेयर लॉस आपनकर स्किन ड्राई होबा किंबा कोर्स होबा आपनको फैटिक लागिबा मसल वीकनेस बहुत कॉमन। तो आपण काम करि परिबेनी जल्दी हालिया हे जिवे मूड चेंजेस हुए बहुत लोक डिप्रेस रुहंती टिके इंड्रॉन रुहंती। आउ जदि आपण अलगा सिम्पटम पचारिबे जदि बेसी परिमाण रे आपनकर हार्मोन कम अछि माने ओवर हाइपोथायरॉइडिज्म ताहले वेट गेन होबो आपनकर वेट बढ़ी चलिबो डिस्पाइट आपनकर खाद्य सेम थाओ एक्सरसाइज सेम थाओ आपनको बेसी ठंडा लागिबो डाइजेस्टिव सिस्टम रे भी कॉन्स्टिपेशन परिमाण बेसी होबो। आउ जदि आपण स्त्री लोकन कथा कहिबे ताहले मेंस्ट्रुअल इरेगुलारिटी माने पीरियड एब्नॉर्मलिटी भी देखा जाए। शिशु तो शिशु मानकू को सिम्पटम हेई पारे जोटा कि यूजुअली आमे बड़ लोकन देहरे न देखि पारू। शिशु मानकू भी हाइपोथायरॉइडिज्म हेई पारे जेमति म आपनको बुझेली। फर्स्ट हैला ग्रोथ एब्नॉर्मलिटी तांको ग्रोथ रेट कमी जाई पारे जेति की अमाउंट रे तमको ग्रोथ होबा कथा तांकर बयस जोगु सेटा हुए नाही फर्स्ट सेटा कमी जाए। अलगा सिम्पटम जेमति की लैक ऑफ कंसंट्रेशन से मानक कंसंट्रेशन स्कूल रे पढ़ा रे डिक्लाइन करे भलो रुहे नाही। वेट गेन हेई पारे मोटा ही जाय पारे छुआटी से माने बहुत समय रे फैटिग माने